Quando si parla di vasculiti si pensa subito a delle patologie autoimmuni classiche come le vasculiti anche associate o la poliarterite nodosa. Tuttavia anche le malattie autoinfiammatorie possono presentare delle manifestazioni vasculitiche, spesso atipiche e difficili da inquadrare. Abbiamo voluto approfondire l'argomento con il professor Ahmet Gul in occasione dei lavori del sesto corso EUVAS sulle vasculiti in corso a Trieste. Professor Gul, quali sono le principali malattie autoinfiammatorie in cui la vasculite rappresenta una manifestazione clinica rilevante?
Monogenic autoinflammatory disorders are a growing list, and among them there are some manifesting mainly with vasculitis, or vasculitis could be one of their manifestations. I can start with DADA2, ADA2 enzyme deficiency, which is associated strongly with early onset poliarteritis nodosa or early onset ischemic strokes. So, which was described about 10 years ago, and the mutations are causing an enzyme deficiency. Very low levels of enzymes are associated with activation of innate immune system, which is resulting in a clinical picture resembling very much to the idiopathic poliarteritis nodosa. In other conditions such as FMF, familial Mediterranean fever, or meval nut kinase deficiency, there is an increased risk for developing other types of vasculitis, for example, IgA vasculitis. Also, FMF is strongly associated with polyarteritis nodosa, or the mutations associated with FMF is increasing the risk of Behçet's disease. Similarly, in meval nut kinase disease, there is a risk for IgA vasculitis and also Kawasaki disease. Very interestingly, mutations in the gene encoding protein A20 is causing a condition mimicking Behçet's disease. Behçet's disease is known as variable vessel vasculitis, but in HAT20 or insufficiency for A20 is resulting in a condition resembling Behçet's disease with mucocutaneous features, but also retinal vasculitis. And some patients are also developing venous thrombosis or thrombotic event after manipulation such as catheter induction or dural sinus thrombosis. So HAT20 is another example of autoinflammatory condition associated with vasculitis. There are also another group, a bigger group, named as interferonopathies, such as SAVI and COPA. They are also associated with small vessel vasculitis, mainly affecting skin and lungs. So these are the major ones.
In che modo la vasculite associata a disordini autoinfiammatori si differenzia da quella delle vasculiti autoimmuni classiche?
Well, if we start with polyarteritis nodosa, those associated with autoinflammatory condition, the clinical picture is quite similar, but the disease is starting early. So very early disease onset, high acute phase response. A refractory state for the standard treatments are always suggesting something else. And a family history could be another reason to suspect from autoinflammatory conditions. I think the most important one is early disease onset. The only exception might be VEXA syndrome, which is associated with somatic mosaicism, mutations occurring late in adult life. And those patients are developing an autoinflammatory conditions, sometimes associated with vasculitis such as giant cell arteritis or polyarteritis nodosa at relatively late ages. And VEXA syndrome is an exception, which is an adult disease.
Per concludere, professore, quali strategie terapeutiche risultano più efficaci nella gestione della vasculite in questi contesti?
Well, it is really necessary first to diagnose these patients as early as possible, since there are differences in the treatment strategies. For example, for polyarteritis nodosa, glucocorticoids and immunosuppressive drugs are the first choices. But for the DADA2 associated polyarteritis nodosa, the treatment is usually associated with anti-TNF. So the TNF blockade is the preferred treatment for DADA2, which is not used in idiopathic polyarteritis nodosa. Similarly, for HA20 patients, anti-IL-1 or anti-TNFs are preferred options. For interferonopathies, JAK inhibitors or anti-interferon drugs are again preferred treatments, which are not used as a treatment in idiopathic or multifactorial types of vasculitis.